What is magical thinking? Magical thinking is when a person believes that specific words, thoughts, emotions, or rituals can influence the external world. For example, they might worry that if they do not wish someone well, then something bad will happen to the person. Many people engage in magical thinking. For example, superstitions encourage people to believe their actions can lead to good luck or misfortune. Some mental health conditions, such as obsessive compulsive disorder or OCD, can also feature magical thinking. Watch on to learn more about magical thinking. What is magical thinking? Magical thinking means that a person believes their thoughts, feelings, or rituals can influence events in the material world, either intentionally or unintentionally. The person may literally believe in magic or supernatural forces, or they may simply worry that their inner life could influence the world in unexpected ways. Jean Piaget, an early pioneer in psychology and child development, believed that magical thinking was a hallmark of the pre-operational stage of cognitive development. This is the stage between 2 and 7 years old when children develop language and abstract thought. It is also when they begin symbolic play or playing pretend. However, magical thinking can also play a role in some mental health conditions such as obsessive compulsive disorder or OCD and delusional disorders. Examples of magical thinking. Some examples of magical thinking include superstitions. Superstitions are a form of magical thinking in which a person believes that specific behaviors, such as wearing the same shirt during every baseball game, can influence unrelated human events. Rituals. Many people perform rituals to gain a sense of control over life. For many, it is not harmful or a sign of a mental health condition, but extreme, rigid, or anxiety driven rituals such as excessive hand washing can be a sign of a mental health condition. Unusual religious beliefs. Although some religious beliefs may have similarities with magical thinking, the two are different. However, they may consider extreme or atypical religious beliefs to be the result of magical thinking. Childhood thoughts. Young children are still learning about how the world works, so they may assume that their internal and external worlds are more closely connected than they are. For example, a child might believe that something bad happened to a family member because the child was angry at them. Delusions. Some delusions involve magical thinking, such as the belief that a person can control others with their thoughts or that they have godlike powers. Advantages and disadvantages. Whether magical thinking helps or harms a person very much depends on the type of thoughts they have and the emotions or behaviors that come with them. Magical thinking may benefit a person by giving them a sense of control in a situation in which they have little control. For example, superstitions might help a person feel less anxiety while awaiting test results. Sharing magical beliefs with others may also give a person a sense of community, such as when sports team superstitions are part of team bonding. However, some types of magical thinking may cause harmful effects such as stress and anxiety. Some magical thinking is fear based and may cause anxiety. For example, people may worry they could accidentally harm themselves or others with their thoughts or emotions. This can cause stress, which harms mental and physical health. Distortion of reality. Magical thinking may disrupt a person's understanding of reality. This can occur in schizophrenia and other delusional disorders, but may also occur in people without this diagnosis. Over reliance. People who believe magical thinking works may rely on it at their own expense. For example, a person may rely on prayer to treat a medical condition instead of seeking help from a doctor, which could be dangerous. Similarly, when magical thoughts or behaviors do not work, a person may feel upset, angry, or powerless. Extremism. Some magical thinking promotes extreme beliefs and behaviors. Magical thinking does not necessarily lead to these outcomes. It is also important to note that looking down on some types of magical thinking and not others can reinforce inequity. For example, early European anthropologists thought magical beliefs are a hallmark of more primitive cultures and that European cultures are, therefore, more advanced and superior. This idea is part of what fueled colonialism. Magical thinking and mental health. Magical thinking can be a feature of several mental health conditions. This include obsessive compulsive disorder. People with obsessive compulsive disorder have intrusive thoughts, which are scary thoughts that seem to come from nowhere. Sometimes these are magical thoughts. Even if a person with obsessive compulsive disorder is not typically superstitious, they may become fixated on a superstition due to these thoughts. Generalized anxiety disorder. People with generalized anxiety disorder can also have magical thoughts. For example, they may feel anxious that if they stop worrying about something, what they are worried about will come true. Delusional disorders. Delusional disorders such as schizophrenia can cause people to have magical thoughts or perceptions. If a person's magical thinking is a symptom of an underlying condition, the treatment options include psychotherapy and medication. Psychotherapy helps a person challenge and change magical thinking over time. Sometimes people may also need medication to reduce their symptoms. This may include those with delusional disorders. However, the mere existence of magical thinking is not always a sign of a mental health condition, and this type of thinking does not always cause harm. Managing magical thinking. If a person has magical thoughts that cause anxiety, they can seek help from a doctor or therapist. They can also try at-home strategies to reduce the impact, such as delaying. When a person notices boring magical thoughts, they can try waiting before they act on them. During this time, they do not need to try and push the thought away or stop thinking about it. Simply waiting and doing something else can mean the thought vanishes along with the anxiety. Thought experiments. When magical thoughts come to mind, a person can try noticing the outcome of not engaging with them. For example, they could observe the effect of not engaging on their emotions or whether anything bad happens. People can record the results of these experiments in a journal so they have a record. Starting small. If it is difficult not to act on magical thoughts, a person may want to start by challenging a minor superstition they have before working up toward deeper magical beliefs. This approach is similar to exposure therapy, one of the treatments for obsessive compulsive disorder.